Christina, her complaint is probably one of the most common complaints.
My eyes look droopy and I just kind of had a tired look on my face, and I wanted to have that corrected.
Most patients that see me, they just want to look like themselves but rested.
When I first met Dr. Parse, I was pretty amazed because he's a very nice person, first of all. He's a very professional person, and he's sweet, and he makes you just feel very comfortable.
First thing I do in my office when I see a patient, I ask them, how can I help you? It's the most important thing. And I just listen to them talking. It's their chance to tell me exactly what bothers them.
I came in here and I wanted his opinion about what I could have done to look, to avoid this kind of droopiness on my eyes. And he suggested me to do an upper eyelid surgery.
So in Christina's case, she just needed an upper eyelid blepharoplasty. This is not a cookbook method of fixing people. We all have our own unique characteristics. A blepharoplasty for her is going to be different than a blepharoplasty for some other person. We individualize a treatment program for the patient, and it could be an upper eyelid blepharoplasty, it could be a brow lift, it could be other things.
When I met him, he just went through the whole procedures, how long it would take, and the healing process, and what I could expect of the results.
It's a very simple procedure. It's an outpatient procedure. The procedure itself takes about an hour and a half, could be done under local anesthesia, and they just go home the same day. And recovery is quick. It's about 5 to 7 days. We see them a week after surgery and take out the stitches.
The results that I had with this surgery, first of all, I wanted something that looked natural. I actually did not want anybody to know that I had a surgery.
As you see Christina, she looks fabulous, I think. She looks natural. You can't tell there was anything done. There's no lines of incision that you see. Everything just healed so beautifully.
That's where I like him a lot, because he goes the natural way, and he goes all the way to make sure that you get exactly what you want.
The key is to make the patient look like themselves, but just refresh and rested. And I think that really is what defines a good plastic surgery, is when nobody else can tell what you had done.
Nobody has even said anything, but people noticed that I looked fresher, I looked healthier, and I looked younger. So they're like, what did you do? What did you do? So, that makes you feel good.
You look amazing, really. She came up to me and she said, this is exactly what I wanted, and I'm so happy I did. This is one of the best things I've done.
I feel I look 5-10 years younger, and that was the whole point of it. And he made sure that happened. He's a very good doctor.
Bye, guys.
And it's just amazing. I love it. I love the job he did.